Well, hello, everybody. I'm glad you came to our lecture this afternoon. There's a lot of information about osteoporosis, leading to how can osteoporosis be reversed. And I have to say that this lecture will be like the tip of the iceberg because there's so much information out. It's coming out rapidly about osteoporosis. And of course, I have to check it with the proper sources, the International Osteoporosis Foundation, and the Bone Health and Osteoporosis Foundation, formerly the National Osteoporosis Foundation. So by the time it gets to you, it could be rather lengthy. So what I do is I skim the surface in the lecture, and then my assistant Gabrielle will send you a packet to take home, so you'll have the information at hand. Now, the information that I do present is pertinent. It's very, very pertinent. There's a lot of numbers with some of the pages that you're going to see numbers for milligrams of nutrients and numbers about how much weight you should be lifting. And it's all going to be clarified and it's all going to be simplified with my partner here, Terry Geddes.
Hello.
So Terry is with us on my right, and she will be probably doing whatever I can answer. Okay. Terry's been with the program for a long time, and she's very familiar with the exercises and all the modifications that we offer. And she's very familiar with the nutrients, and she's very familiar with all aspects of osteofitness. So I just like having Terry here. She'll be a good model showing you some of the exercises and their modifications. Part of our program is nutrition. We have a strong arm on nutrition. And the only way you can, I think, teach good nutrition is to eat it, not just hand out recipes and talk about food. So we have these luncheons every 2 months when the program is restarting. Each program is 2 months. And then we have a chance to share recipes that are bone healthy, and we bring in the recipes so that we can have them on hand in our kitchens or send them out to people who need some ideas because there's a little bit of a lifestyle change eating food for bones. I'll just let you read that. This is too long. But I have had a switch over from allopathic medicine, being a nurse and RN and specialist in neurosurgery, and coming into this holistic field of health and choosing osteoporosis. So I've got a lot of background in allopathic medicine and combine it with this pursuit of holistic medicine that a lot of people are taking. So we're eating again. We will get to the exercises, but I want you to notice that people who are in this program enjoy it. We always enjoy getting together. People on Zoom have a good time. We seem to not be light about our situation, and we're serious about building bone and getting healthier, but we enjoy doing it, and it's not an enormous chore because there's a lot of support within this program, even through the Zoom people. I guess we will be discussing osteoporosis versus osteopenia and how the diagnosis is arrived, and risk factors and stats, medication, and holistic treatment. There will be a lot on the fall and fracture prevention, a lot on the exercise, nutrition, and stress management. A lot of programs for osteoporosis don't stress how well stress can prevent the building of bone. So I do go into that thoroughly with this program. Osteofitness is the name of my program, and it's very well described later on. And then we will have some contact information provided and some questions at the end. I think this is a common picture. On the left, you'll see normal bone. Normal bone is porotic. Normal bone has holes in it to make it lighter. Otherwise, we'd be walking like the knights of shining armor with 500 pounds of metal on us. So the bone is porous, and then the osteoporotic bone has lost its walls and its connections, and that's what makes it very brittle, setting you up for a fracture. The constant remodeling, bones, all cells die and new ones are produced in every organ. Did you know that, Terry?
Mm.
Skin?
Yep.
Yep. So we often talk about, what are we doing? Exfoliating.
Right.
And that takes off the dead skin, and then the new cells are free to emerge. And the same things are with the bone, but we can't get in to scrub them. That's the thing. You can't take your loofah onto your bones. So we do have special bone cells that take away the dead cells, and they are called osteoblasts, osteoclasts with a C. And they are replaced by osteoblasts. And that is the cycle. But up until about age 30, we're building more bone than bone is being taken away. So people grow and they get stronger and children get taller. And then after about age 30, we start seeing more clearing away of bone than there is of the building. So that's where we have to come in and just we strengthen that weak part of the remodeling. Seems that women over 50 are more likely to have an osteoporotic fracture. Now, did you know, Terry, the risk of a heart attack, breast cancer, or stroke combined is less than osteoporosis? Okay, so you're more apt to have an osteoporotic fracture than have one of those. Now, the weakened bone is called osteopenia, and we'll get into the values and how you determine one from the other later on. This is a very, very mild amount of radiation, a very small amount, and this is how they diagnose what they call bone density. This is called a DEXA scan. It is not a bone scan. It's a bone density scan. A bone scan involves dyes and gives you a different picture of the bone. So we have to talk about bone density scan, BMDs. There's a number. Anything higher than minus 2.5 is osteoporosis. And if you are minus 2.6, you will be diagnosed with osteoporosis as you would if you were minus 4.2, extreme osteoporosis. They don't differentiate. It's not mild, moderate, and severe. It is definitely osteoporosis or not. So that's why it's important to know your bone results and looking at the column that says T-scores. Have you seen yours lately?
No, not really.
Okay, but I'll look at it. That's what I do. I
Okay.
look at these results. This is trabecular bone. This is new. This is a new topic. It's a very old part of the osteoporosis research, but it's just coming to surface right now. And unfortunately, there's not enough information to give you a lot of hope. But scientists were not satisfied with just the bone density because that is the minerals on the outside of the bone. And it was disregarding the role that the inside of the bone would play, which is called the trabecular bone. And so they're now looking at devices that attach to a DEXA scan that will give you whatever the trabecular bone rating is. And they're about 1.3. They're sort of numbers like osteoporosis is minus 2.5. And what they're hoping to do in the future is take the values of the trabecular bone, if it's been scanned, and the cortical bone, which is bone density on the outside, and give you one number that will equal strong bones or not. But in the meantime, first of all, the education is very scant about this trabecular bone and how to interpret any results from a device that you would put on the DEXA scan. There's just not enough information or enough people educated in how to use it. So this is a cry of the research on TBS. We need more time, and as it comes out, I'll pass it on to you. Carrie, do you want to read the risk factors?
Okay. Have you had a fracture? Do you have a low BMD, bone mineral density? Any history of broken bones? Any family history of osteoporosis? Do you lead a sedentary lifestyle? Do you have a childhood history of inactivity, low calcium intake, or low sunlight exposure? Are you small and thin? Do you smoke or drink alcohol excessively? Is your sodium intake more than 2,300 milligrams per day, or 1,500 milligrams is ideal? Do you have a chronic stress?
So we'll stop there. If you've answered yes to any of those, then you're at risk for what?
Osteoporosis.
And a fracture. These are what they're always looking at. What is your fracture risk? So now we're going to go on to these.
Okay. Do you have any of the following conditions? Do you take any of the following medications?
So I'm going to touch briefly on that, but that also is in the take home. Here's in the big box, a very important message from Dr. Merle LeBoeuf. She is an expert on osteoporosis, and she is professor at Harvard, director of Bone Health and Osteoporosis Foundation. And as you can see, she's a very distinguished person and has emailed me to say, Beverly, tell your clients that increased cortisol is associated with lower bone density. So we're talking about cortisol being the stress hormone that comes up when you see a bobcat on your back porch. Remember that, Terry?
Yeah.
And it shoots all through your blood system and it alerts your body that you have to run. You know, it's the fight and flight energy. So you want to make sure that you have some device to lower your stress, because what they're saying today is most people don't have the highest stress level, but they have chronic stress, which is worry equals worry equals worry equals having regrets, having just sadness, and just not moving forward and excelling into like a higher energy level. So when she talks about that, that means we automatically went into some stress management techniques, which we will bring up later on. The conditions that are associated with low bone density: hyper or hypoparathyroidism, hyper or hypothyroidism, type 1 diabetes, early menopause, rheumatoid arthritis, cancer, scoliosis, and sarcopenia. Sarcopenia is a natural loss of muscle cells as people age, but it cannot happen in our program. It's not allowed, okay? These are just a few of the medications that could be in conflict with your bone growth program. The glucocorticoids, especially when they're long-term, anticonvulsants, levothyroxine, and the SSR antidepressants. There's another list of medications to watch out for, and where is that list? It's going home with you. All right. I have to talk about the medications for osteoporosis. They're really divided into two great big categories. One is the anti-resorptive, and you all know Fosamax. That's a big name. That's a major player in the anti-resorptives. And what the anti-resorptives do is they prevent the osteoclasts. I mentioned them earlier. They were the cleaners. They were the loofah sponge that took off the dead cells or the dead skin. And Fosamax is a very famous one. But prior to Fosamax, there was another anti-resorptive medication, which was estrogen replacement therapy, which is very rare these days because it had some side effects. And the Prolia, which is today very common, and Evenity. They're different types of biphosphonates, but they're administered differently, but they're basically the same biphosphonate base, and that their function is to prevent the removal of the dead cells. So somehow there's a nice looking image with a lot of volume to it, but it's really not good bone. And that's why one of your first side effects of these biphosphonates is
What's the first?
the fractured femur. and fractured jaw. So dentists, well, for the most part, do not work on somebody who's in an active program of anti-resorptives. But I also know that some dentists will refuse treatment if the patient has had a history of anti-resorptives, claiming that some of it still stays in your system. So that's sometimes on a dental intake sheet. Have you been on any of these medications? I think that is enough for that. And the anabolics, that's another group of medications. They stimulate new bone growth. There's Forteo, the parathyroid hormone. It's so wonderful. It builds bone. Isn't that great?
Yeah.
But it's hard to get at it, and it's quite expensive. And Timlos is another one. But these three drugs are, famous for building new bone in different areas, but they also have their side effects. And when people read about the side effects, it helps make their choice, yes or no. So that's all I'm going to say about medication. And just add the note that if you are on the medication, that is fine, but you still need the safety net of the exercise class, the nutrition, because these drugs cannot be taken for the rest of your life. A few years, then they'll change it, put you on another drug, and on it goes, and then you're getting subjected to different side effects. So it's really just good to have the medication if you want it, and also build up your bone with exercise and nutrition. Compression fracture. I'm going to demonstrate two vertebrae and a disc. And then we'll come back to this. Okay, so these are just two very well-dressed rolls of toilet paper. Terry made outfits for these rolls of toilet paper. Each roll represents a disc, and the discs on top of each other would wear each other out. So we do have a lovely addition of a disc in between the vertebrae to soften any impact and to give the vertebra some flexibility. Posture, when it's leaning forward, is very, very detrimental to the spine. And what happens is, as you lean forward, the top vertebra could be coming beyond the bottom vertebra, and it forces the disc to go to the back of your spine. And that's where the nerve roots are. So when you see somebody with a leaning forward posture, then you know that their vertebrae are not aligned. And very probably they have what is called compression fracture. And that would be how a vertebra is fractured from having its impact and its pressure abnormally put on it for a long period of time. Terry made these. Thank you very much, Terry.
Welcome.
I'll have to think of something else for Terry to make. She did such a good job with those. All right, can we go back to the slide on compression fractures? So, as you can see, they start off with maybe just a few lines, and then if it's not corrected, now we're reversing the side view. This is from the right now, and this is from the left. But the compression fracture, the fracture keeps on going unless the pressure is taken off, unless we realign the vertebra and do some work on preventing any further compression fractures. And we do that in this class. People don't feel a compression fracture at first. They're silent, but people will notice that they're losing height. And people say, I'm getting shorter. My grandchildren are taller than I am, and they think it's a part of life. It's a part of compression that's shrinking your spine. We deal with that in this class too. What's our favorite thing for decompression of the spine?
The ball on the wall.
Would you like to show us?
Sure.
Terry's going to show us how we decompress the spine. The ball on the wall, it's called.
Should it go?
Okay, I think this is the best wall. We ask you to bring a play ball to these classes. This is the play ball.
Yeah.
The,
Behind you there. Lean against the wall, standing a little bit away from the wall. And try putting one arm up towards the wall and the other arm up. And you may not reach the wall, and that's okay.
so you're stretching the vertebra one away from the other, and this is what called decompression. And you can bend a little forward, flex at the hip. Now start stacking your vertebra up on the ball a little higher each time. We do this maybe 3 or 4 times, and people just love the feeling of it. Another way to decompress your spine is to just lie on the floor. You don't need to show that though, Terry, right? No. Okay. So thank you. You can come back. There were a few other things on that slide. Sometimes when the fracturing continues, there will be some pain. But right off the bat, one compression fracture doesn't normally cause pain. They are diagnosed with an MRI. A regular X-ray will not show a compression fracture as well as an MRI. And the allopathic treatment out there in general medicine would be some cement injections and some bone building medication, like I mentioned earlier, Timlos and Forteo. And the holistic treatment for a compression fracture would be some specific exercise nutrition that we provide here. And it's a very successful program, but we're not going into it now. As I said, this is the tip of the iceberg lecture. There's your hip. This is a face view. You're looking from front to back. And the fracture here is a real osteoporotic fracture from brittle bones. And this is the femoral head. And we have fractures in those areas too. These are popular, very popular spots for an osteoporotic fracture. And quite often there's a fracture there and then the person falls down.
Mm-hmm.
They don't necessarily fall and then fracture. It can be both directions. But 50% of people who fall and fracture will need assistance walking for the rest of their life. 25% will end up in a nursing home for the rest of their life. Mm-hmm. And 25% will die. So it's not a regular fracture like if a child falls off a horse. An osteoporotic fracture has a lot of risks, and people do not recover from them to normal position that they were before. And the rate is increasing, and with this winter past, the emergencies were pretty busy with all kinds of fractures. Walking can just result in a hip fracture. Remember I told you one of the side effects of the biphosphonates was, brittle bone because it wasn't good bone. Those are the people that stand up and fracture, then they fall down. So that's a very, very common occurrence. It's not nice, but that's where the strengthening with the exercises comes in. Fall prevention. It's possible. Did you have a fall this winter?
No.
That's wonderful, but you've had one in the past.
Yes.
And Terry has learned not to fall. She's also learned some techniques like during the day that she can do or in the morning for her balance and agility. And I just wanted to run over the team. There's a lot of team members in the balance team. One is the eye. You really need to have clear vision, have your prescriptions up to date. And your inner ear is important. If you have wax in your ear or if you're on an antihistamine, little swelling in your ear, your balance will be off. And your joints and muscles have to be functioning well to establish good balance. You have to have good footwear. There has to be home safety. And dehydration, we talk about that a lot,
Yeah.
but it can make you very dizzy, and it can actually affect your memory if you're dehydrated. So most gerontologists are now suggesting to their senior patients, hydrate, 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 and you may see a comeback in some of your memory. Balance, agility, and coordination. You all know what that means. Agility means getting from one place to another. Coordination is being able to operate to show us the bouncing of the ball. This is what we do to develop some coordination and agility. We take our play ball, and Terry's going to demonstrate this.
You can also try putting one foot, balancing on one foot, but just try, call it 1.5 foot. You try the right foot on top of the arch of the left foot, balance that way.
So she's standing on 1.5 feet. And then after that,
And then after that, you can try balancing on one. This is what we call kickstand if you're having a little trouble still.
oh, could you stand sideways for this, please?
Yeah.
She'll take one foot and just put the tippy toes.
And then you can go back to one foot and you can feel steady.
So we're getting some agility, some coordination, and balance, all from one little ball. Thank you, Terry. So then we develop more balance by developing proprioception, but we'll deal with that later on. It's called retro walking. And then, of course, there's strengthening. Strengthening does help prevent a fall. There, we've just shown you some balance and coordination, but the daily drills improve your balance and prevent falls. When people first come to class, they really struggle to do whatever the balance exercise is. But we break it down into components, so there's an easier part. Like Terry broke that down to 1.5 feet to then kickstand before you stand on one leg and feel like a failure, because a lot of people try that tree yoga pose and say, I can't do this, and that's the end of it. But we take balance from the very beginning of the skill and build it up. And now we have, a lot of people saying, wow, I do this every day at the kitchen sink, and what a difference it makes. And there's quite a few causes of dizziness. There's great medical conditions that would cause dizziness. And of course, if you did have this, you'd be under doctor's care. But blood pressure and some medications, low blood pressure, dehydration, alcohol or narcotic use, anxiety. That's where the stress management comes in. And the colds, not just the cold themselves, but sometimes the medication and the antihistamines that you take for the cold. Okay. Now, we never do that in class, do we, Terry?
No.
Do we try it?
No.
Okay. So we don't want you to worry about that. I just want you to know there's some things out there on the internet that are very bad for your body. And in our class, we're more on the cautious side. We do take into account that the strengthening is serious, but we don't take a lot of high risk. It's really a sensible class that works.
Right.
And proprioception is understanding where you are without your eyes. You want to be able to shut your eyes and feel your way around a dark room. Or if it's dusk and it's getting dark out, you need to have some kind of sense of where the sidewalk is or where your car is. And we do develop that sense called a kinesthetic sense and proprioception with special exercises. And I think our popular exercise, excuse me a minute, walking backwards. All right.
Okay.
This is proprioception. It looks like he's walking. It's hard to tell what he's doing, but he's walking backwards. Now you're going to see articles on this because it's come out and it's been very popular, and people just say start walking backwards, and we don't do that. It's a little risky. So what do we do, Terry?
Well, first you look at your path, walk forward, say, and count your steps, say 6 steps. Then you look back once to just check your terrain and see if there are any obstacles or where you're going. And then you can walk back with confidence 6 steps again.
As opposed to just walking backwards out of the blue, which could throw somebody for a loop. So we have to make sure that you understand that walking backwards is good for you, but you have to learn how to do it properly so you don't fall. Next. Terry loves this. I have to get her off the stage. Come on. That's enough of that, Terry. Okay, now we have, if you're going to look it up, it's called retro walking. It has a lot of medical benefits, cognitive benefits. There's a lot of use of this retro walking in child development, and it helps a lot of joint pain, and it's just a gait improver as well, GAIT. So when people are stuck in a pain pattern of walking, I'll take them through a backwards walking program, and then when they come back to their original program, the joints have had a holiday and they're ready to go. But we walk we do most of our things so repetitively that the stress on the joints is da 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 on and on and on and on. And when you've got pain, you've got to break that cycle. And this is the best way to do it. I have great results from this, and we do it in class. We do it with partners, right? If anybody's afraid of falling over, they have a buddy.
Right.
Okay. There's your hips. Can you see your hips very well there? I don't know how many of you are familiar with the skeleton, but it's now time for Terry to do some more exercise. And we've come to the strengthening part of the program. We just don't come into class and pick up weights. That's the best way to tear a tendon or strain a muscle. We warm up every single joint in the body that is going to be used. And we're warming up now shoulders. It's just movement. Movement warms up a joint. Movement can lubricate a joint. Movement can bring blood to the muscle. Because when we start applying the resistance to the muscle with the weight or our body weight, if that joint hasn't been warmed up, it'll injure. So that's why we warm up, because we don't want any pain from these classes. So there's the swimming. And then we have another good one for internal joint, deep, deep, deep within the shoulder joint.
Rotate the shoulder joint, but kind of keep the arm, don't involve the arm, just let it hang. And then you go both directions.
A good amount of time, like 20 or 30 reps. Okay.
Mm-hmm.
So those were the shoulders. We could do a couple of neck turns.
Okay.
With the shoulder blades together.
Shoulder blades together. And back to center. Do it again to the right. Back to center, and then to the left. Back to center. And to the left. Shoulder. To the right.
Very nice. So that's neck and shoulders. Now we're going to do a warm up, which also includes a little balance. So you should have your chair ready. We're doing the hips now. The hips need a lot of warm up. There's a lot of muscles attached to the hip, and there's a lot of function in the hip. So we want to make sure that the hip joint can take all the strengthening that will follow. So we do a very thorough warm up. everything we're doing today, of course, is a sample.
Mhm.
So Terry, we do Garden Gate. Let's
Okay.
talk about Garden Gate.
Garden gate. So bend the right leg up and then turn it out and turn the hip out, bring it back and down. The knee up, out, back and down. And don't twist the body. You're just turning at the hip point. And then
Now, do you want to do it without the chair? No, some people do it without the chair. Some people use a chair. So we don't even care. Whatever you need, your balance develops over time. But the most important thing here is being upright and opening up the hip joint. So whether you use a chair or not, ça fait rien. So we'll just take it for granted that you'll do the other side, Terry. Okay. Thank you. And we also do the ankle. Remember the ankle?
okay.
It has to support us, and the ankle goes through a lot of motions when we're trying to retrieve ourselves from a fall.
Put the right leg out and flex and bend. And then put the leg out and turn the ankle. Rotate to the right. Rotate to the left.
We're still warming up. And we'll just do the one leg. How's that, Terry? The one ankle. So we talk about, I've been mentioning retrieval. Some people slip, but they don't fall because they have retrieval skills. That means they do a little dance to regain their posture and alignment. So why don't we do what we call dada? This is what we do in class to develop that reflex so that we can retrieve a missed step that we ward off.
Da, 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 da.
Yeah, dada, dada, dada. Da, 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 da. Side, 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 side. I'd say wide, 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 in, front, 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 back, 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 da 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 and stop. There. Ta-da. Nice. So we do a lot of footwork that gets everybody out of a mess. If you think there's a little bit of ice somewhere and you start to lose your step, these retrieval skills work, and that's why we haven't had falls with fractures. Okay. Thank you, Terry. So this is the osteoclast I was telling you about on the left, and this is the clearing away of the dead cells. And this bottom circle is the new cells being built by the osteoblast. And this goes home, doesn't it? Okay. But not every exercise builds bone. And this is why I'm talking about exercise and a program for osteoporosis. The exercise for osteoporosis is designed and targeted to osteoporotic sites on your skeleton. And the osteoporotic exercises have to increase in resistance, like every couple of weeks or months. That's where I come in. I do talk with everybody. When you sign up for this program, we'll have a 20-minute consult, either on the phone or in person, and I'll go over your T-scores with you. And then we start talking about how you're going to add weight to your bone by adding weight to your hand weight. Okay?
Mm-hmm.
So here we are. There's strength training and resistance training. The weight training uses your own body weight, such as show us a squat, Terry. Mm-hmm. So Terry's going to do the squat, and this is Terry using her body weight to improve some bone density around her neck of the femur and her total hip. And you can come up and down a few times. We do a lot in class. We're just sampling everything today. but the squat can't be done by everybody. But if you notice, her knees are bending and her hips are flexing a little bit. And this is very, very important to know how to do the squat properly. Some people go too low. Some people start jumping with them. That's not it. But Terry, that's good. And I think you need to know now what resistance training is. So now you'll go for the hand weights.
Okay.
So we're still in the strengthening program. The first part was the warm up. So we've completed the warm up. Now Terry is using 4 pounds when in real life she uses 10, but she worked up from 2 pounds. See, you start with a low weight so you don't injure yourself and to train the muscles how to work. But then you gradually go up in weight, and then she's reached a very, high level of resistance. So would you just show us something like the exercise we call laundry?
Okay.
Have a good stance.
Laundry. Bend the elbows, arms come up.
Shoulder blades come together. That's important, shoulder blades. Okay, we're increasing our posture, we're improving it, and we're building bone in our upper spine. And we're building bone in the part of the spine that falls into Dowager's hump. And we're building the part of the spine that goes into the forward leaning of the vertebra, causing a compression fracture. And we do a lot of these until we reach extreme fatigue. So another exercise for the upper body. How about showing us the tricep kickback? So she bends at the hip. Ta-da! Elbows on the body and take it back. Just straighten your arm, bend, straighten. So this is an elbow function. We're not moving the whole arm. The shoulder's fixed. The trunk is fixed. And Terry is working the muscle from above her elbow to her shoulder. And we try to get every muscle to work to extreme fatigue. So she's still using her 4 pounds. That's nice, Terry. So now we're going to pick one more upper body exercise. It's called the overhead press. But most people like to go lower. So I'm all right with that. What have you got now?
2.
Okay, so she's gone to 2 pounds, and show them how we test.
Testing 1, 2.
We never go overhead immediately.
Make sure that I'm okay with this, right?
And okay. Nothing hurts, right? Overhead press, Terry, go. So she goes down and up. We've tested her. The shoulder works with a small weight. She's gone lighter in weights, which a lot of people like to do for overhead press because we do a lot of them. And when these become very easy, then we'll go to 3 pounds, we'll go to 4 pounds. And Terry is now using 10 pounds overhead. Okay. So the progression into weights happens naturally. Nobody forces a weight on you. That's when you strain and sprain and get an injury. The progression of weight makes your muscle enjoy the new challenge, the new resistance. Okay, Terry, how about some water? We drink water during this class too, don't we? Hydration used to be forbidden in an exercise class. It's now indicated that it's helpful. So have a little look at the back row. Now, as we went lighter for the overhead press, we go heavier for the back row because the weight is designed for the muscle involved. And this is a huge muscle, a big slab of muscle on each side of the vertebra from the neck down to the sacrum. So we go heavier for the back row. So she has one leg in the front, bending at the knees, flexing the hip or bending the hip flat back. And she's bringing her elbow up beyond her body, but she's not rotating her body. I'll tell you how some people do this. It is so wrong and it is so dangerous. Show us how you rotate it and look at the ceiling when you come up. That's what you'll see, and that's got to be stopped immediately. You have to put out the fire because you're twisting your spine, you're rotating your spine with a force, and that will cause a compression fracture. Bingo. So we keep the spine in alignment while we're strengthening the muscles alongside of it. And then we do the other side. We do the back row separately. And immediately when you've done all that we do in class with this, you start to stand up a little better. You just feel better. You can pull your shoulder blades together. You can breathe better. Okay. It's like a little miracle exercise, that one, isn't it? So now we've got some lower body work to do. Would you like to go to the floor, Terry? Now we do have modifications for every single exercise. Every single exercise can be done standing. We're showing you the floor version because we do that a lot. People like the floor, but if people can't do the floor, we have modifications so that that muscle set can strengthen the same skeletal spot in the standing position.
Start with the leg weight
That's right.
later on. Yeah. A few classes.
Yeah, and then when you're ready to put a leg weight on, that's when you do it. So Terry's on the ground. We're going to start off with you, Terry, on your left side, so you're facing the class. And this is a simple side leg lift. Imagine your body is a clock, or 12 o'clock is her head, 6 o'clock is her feet. And she's in alignment, and she's just lifting her leg. And she's dropping her toe, and then dropping her heel. So she's encouraging internal and external rotation of the hip. And we will be adding weight to these in about 3 weeks after you join the class and learn the form. Then we start adding that blue leg cuff. And the next thing we're going to show, Terry, is the exercise we call Christina.
Bend the bottom leg. Keep it out of the way. And bend the top leg. And lift up. Keep the
Lower leg.
Parallel with the floor.
So this is called a neutral position. And can you touch the muscle? Can you feel it working? So this is a great hip exercise. You can feel the muscle working under this movement. And it's a very important exercise because it's addressing the hip. There's so many muscles that attach to the hip. We have to do many, many exercises, but basically they're variations on this. So that's nice, Terry. We're not going to do the other side, all right? And we get up by the side. We don't do sit-ups to get up. Very nice. Thank you. You'll have to do the other leg after this lecture's over so you're balanced. All right. I mentioned extreme fatigue. We only did a few as a sample today, but when we work out in class, people are going, oh, because we work enough reps so that the muscle feels extremely fatigued. There used to be a saying, go for the burn. That is no longer the case in exercise. And extreme fatigue is the new lingo. It's the new way to be in a muscle where you're strengthening, but you're not injuring it. Okay. And you'll know it because I guide people through all of the exercises until they reach extreme fatigue. Fascia is a new topic now. It's been around for a long time, and surgeons have to pick at it to get at their surgical. Usually, it was just an annoying tissue. They would say, "Oh, it's supportive. Isn't that wonderful?" But now they're learning more and more about it and how it clinically is involved in pain management and how that the sheets of fascia have nerves in them and they need water. They're a functioning tissue. They used to be thought of as like cobwebs that just supported things, but no, even though fascia does support organs and all the fibers of all the muscles and holds your organs in place so that they don't all fall down into your pelvis when you stand up, they do function and can be extremely painful when it twists. And fascia can twist and never gets untwisted, and they're called adhesions. So we do have quite a few people in pain. I think it's their muscle, they're not sure. But I'm trained in myofascial release, so I do a lot of work in my muscular therapy business to untwist and get rid of adhesions, and allows the muscle to work a little freer. Adhesions can be anywhere, and I seem to have a way of finding them and getting rid of them. But they also need hydration. Okay. The most common osteoporotic sites are hip. The neck of the femur is deep inside your hip. Total spine is from your neck to your sacrum, and the lumbar spine is where your waist is, and the wrist. We're not doing wrist today, Terry, but I know that you like wrist exercises.
Yeah.
Those are one of Terry's favorites. Her wrist has come a long way. And she does a lot of sewing, as you can see. And she has a lot of endurance now in her wrist to do all the hobbies that she likes to do. This is just the post. Okay, so now we have exercises that are not allowed because they can crush the spine. So anything that's involving, twisting, like Terry mentioned, twisting when she was doing the back row. But this is also sitting up, and all those other flexion of the spine exercises are forbidden. The crunches and the setups. Okay, we don't do those. Golf swing and the tennis. Twisting with a force. No, no, no. And these are some yoga poses. There's about 11 yoga poses that are contraindicated. But there we are. We're twisting again and twisting again. So those are out. And a lot of Pilates is spinal flexion. Have you done Pilates?
No.
Like that you go into a V to do the 100s. That's one of them that would be very bad for your spine. And how could swimming be bad? It's really great. It's actually called the best exercise because a proper swim will use every single muscle. But it's when you're going to be doing a very excessive crawl motions, and you're twisting your spine and coming into the water with force that it would be bad. So I don't have a lot of people with swimming needs, but if they do, they speak with me privately about it. Walking, I hate to even mention it because people are very proud of their walking habits and they're defensive almost. I walk every day for 30 minutes. I walk with my dog. I walk with my neighbor. And how could there be anything wrong with it? There isn't. There's one thing, it's weak and building bone, but there's a lot of benefits. Like what?
It's stress relief.
It is.
It's flexibility a little bit and balance.
Balance.
Yeah.
Especially where you walk. Terry walks in these woods with broken trees and branches and has to jump over things. So you've developed a lot of agility by your walk, right?
Right.
But walking does not build bone. So walking does not build bone, and walking does not build bone. That's the end of that. Too bad. But still walk.
Yeah.
Still walk because it's good for you, but it won't build bone. So now we're coming to the relaxation. Okay, we talked about stress management, and I have chosen two relaxation techniques that could be done at bedtime that could help you sleep better and can help you calm down from a very busy day.
Okay.
This is the Herbert Benson.
Yeah. Breathe in 3 and out for 5. Out for 5. And breathe out more slowly and increase the amount of time on exhale as you get better at it.
So Terry's pushing down the stress with the exhalation. And you'd have to do several minutes of this breath, but believe me, it does work. It's in his book, The Relaxation Response. And there's another technique that I have found very successful with people. It's called the head tapping. Mm-hmm. And you probably want to remove your glasses for this, please. This is part of a whole body approach to tapping, body tapping, and I've excerpt just a little bit for the stress of the brain and the thoughts. So we have a map. It's going to be our forehead, our hairline, and the eyebrows. And we're just going around, tapping with the finger pads of our fingers around the eyebrows, up the temples, and across the hairline. This is the front part of the brain that seems to have a lot of action. There's a lot of activity in the front part of the brain, and it gets exhausted and it becomes worn out and it starts to back up against itself. So it's a good thing to just tap that part of the brain, calm everything down, and your thoughts will become clearer and your actions will become more productive. And people use this going to sleep at night. And more often, when they wake up in the middle of the night, then they can re-sleep by doing this head tapping. So it really does have its effects if you keep practicing it. Thank you, Terry. Don't go to sleep.
No.
Okay. So we're going to talk about nutrition is next. Everybody has heard about calcium, probably from childhood, right? Drink your milk for your bones and your teeth. That's nothing new. You know, it's still good for your bones, and it's one of the essential elements for bones. What they figured out is we need, at our age, 1,200 milligrams per day. And what's the important thing about calcium?
Mm-hmm. The important thing is that, well, you should try to get 900 milligrams from food and limit yourself to 300 milligrams from supplements if you can.
That's right. Because
in order to get the 1,200 a day.
Because taking the 1,200 from supplements has very high risk of a cardiac event. The non-dairy products, there are people who are lactose intolerant, so we do have a few salmon, collard greens. You know, prunes come out on top. They come out in like every third piece of literature I get on osteoporosis, nutrition, they're talking about the value of prunes. So it's about 110 milligrams for 6 prunes. And we have recipes for prunes, don't we, Terry?
Yeah.
We have recipes to make everything that's good for your bones edible and delicious. Now, we do have the companion piece to calcium, which is
vitamin D3.
Very important.
Sunshine vitamin.
It is, but it's not enough, is it, in New England? Look at today. So we do rely on supplements for vitamin D3. We do get it from egg yolk and some fortified foods, fatty fish, salmon, and mackerel. And any food that's fortified with vitamin D3 is edible as a food. You're not it's not a supplement crushed up into it. Okay? Nutritionists have explained to me that it's fused into the product, so you can use your vitamin D3 as a food if it's in orange juice or milk. The other thing about vitamin D3 is a very, very important partner of calcium. They work together on getting bone cells built, and they have to always have a very efficient way of getting the nutrients into the bone. So we'll get more on that. Vitamin K 1 and 2. Actually, Not that it matters, but there's about 7 types of vitamin K. We talk about 1 and 2. One is on the outs. Number one used to be the ideal K1 for metabolizing calcium for bone health. And it was from dark leafy vegetables, collard greens, avocado, Brussels sprouts. But they've since found that vitamin K2 in animal protein and fermented foods has a higher effect on calcium metabolism. Now, the animal protein eats grass, so they assume the animal is eating grass, so he's getting his dark leafy greens and passes it on to us through the meat. But of course, there's vegetarians. Then we have the fermented food for those people. The fermented foods include a lot of cheeses, sauerkraut, miso, napa. There's a lot of things with pickles that you can get today now. Pickled green beans, pickled eggs, anything with pickle juice is considered not only a good source of K2, but also a probiotic. Now we have magnesium. Magnesium, the value per day per somebody our age, a woman, is 340 milligrams per day. And it's best from,
Dietary sources. Best from food.
that's right.
Yeah.
But the supplements, magnesium supplements are not dangerous. Magnesium supplements are taken in pretty high doses by athletes to prevent cramps. And you yourself could take a little more than 340 per day if you suffer from cramps, or you have a marathon that you've walked and you have cramps, then you could safely take some magnesium or have a magnesium bath in the Epsom salts, or we use magnesium cream for muscle cramps in my massage business. So magnesium has a lot of effective roles in your body. And like Terry says, with the whole grains, leafy greens, nuts and seeds, avocado, spinach, raisins, and tomatoes. So there's a nice little list. Sounds good, right?
Yeah.
Terry's getting hungry. Okay. I brought turmeric up just because it keeps coming up in the literature for osteoporosis. It's a natural herb. It comes from India. It's used in Indian food, and it comes as powder. It comes as a capsule. And I think they have turmeric teas, and they often mix the turmeric tea with lemon or orange. And it's a bright orange color. It's in mustard. That's why mustard's yellow. So I'm just putting it out there because quite often people have osteoarthritis as well as osteoporosis. Quite often they're seen together. And turmeric has a very high role in being an anti-inflammatory, but it also helps the bones. So I think with all these benefits, you might want to look over turmeric at some point, and it doesn't seem to have a lot of side effects. Of course, like anything, anybody can be allergic to anything. But that's why turmeric is up for its anti-inflammatory and its bone building uh, characteristics. Oxalates or oxalic acid are found in a lot of foods that people love. People who have any kidney condition are warned against any degree of oxalic acid in their foods. There is some in a lot of plants. If you don't have a lot of food containing oxalic acid every single day, you should be okay. For instance, spinach has oxalic acid, but you want to have a moderate amount, maybe once a week or twice a week. And nutritionists with whom I've consulted have said that if you're taking a food that's listed as an oxalic food, then if you heated it up or cooked it, it could lose some of its grip. See, what oxalic acid does is grabs onto calcium and won't let it do its thing to build bone. So that's why we have to, limit its use. And I think this is a take home, but definitely kidneys, no oxalic acid. And that can go home too. Is stress and osteoporosis. before we even talk about stress, some people don't think they have it, but they're on cholesterol medication, they have high blood pressure, and they think that not sleeping well is normal, and they think that having some rashes or pimples or indigestion is normal, so they take other kinds of medication for that. But no, they don't think they have any stress. So there are ways that you can tell you have stress, like go to your doctor and have some of these blood tests and have them take your blood pressure and their cholesterol. But some people know they have stress. Some people know the difference between being calm and being stressed. Some people know that encountering a certain person will bring on stress. Some people know when they see a caller ID come up, their heart starts pounding. Could be good too, right? If you're in love with somebody, yeah.
Yeah.
So, and that's good stress. But I think that most stress that we talk about today is negative stress. And there's Merle LaBeouf again. But I do have a workshop that you can purchase through Gabrielle, very reasonable. It's on the anatomy of stress, and I think you'd find that would be an interesting addition to your education regarding osteoporosis. So it does prevent bone growth. So that's why we have to avoid stress. I just wanted to tell one lady had really moderate to severe osteoporosis, and she worked the program probably, I'd say within almost 2 years. And she came out of osteoporosis and she was absolutely thrilled. And then there was a calamity in the family, and 6 family members got involved, some conflict, and it was devastating. And she was out probably a year and a half. And when she came back, she had gone straight back into osteoporosis. And she realized that it had been the stress that she'd been through. But some people don't know what to do when they're stressed. You have to first recognize it and know that you have it. And then we have some of these tips that we have with the head tapping and the breathing, but these also will help. Exercise helps with stress. Pick out your favorite ones, Terry.
Let me see. The Benson breath is good, and the head tapping.
Of course.
Being in nature, I love that.
Okay.
And I do like herbal teas. Wow, they're all great.
You can only pick 2.
Oh, I can only pick 2.
2 more.
Listening to your favorite music.
Yes.
And helping others.
Very nice.
Yeah.
That's enough, right? But this list is going home. So you could definitely find ways to reduce your stress. And sometimes one would work, and another time you would need another one. There's not going to be one thing that's going to de-stress you every time you use it, okay? Because different situations require a different solution. That looks good, doesn't it?
Yeah.
This is when your body repairs itself. This is when your immune system gets strong and toxins are removed from your body. This is when you refresh your memory and your learning. And what they're saying now is 7 to 9 hours of sleep per night, with or without a cat. It doesn't have to be with a cat, does it, Terry?
No.
No.
What happens when you're away and the cat sleeps on your side of the bed? When I go visit friends when my husband's alone.
Well, the cat moves in.
Cat takes over my side of the bed.
I would say leave that cat alone. Let him do what he wants, okay? There. But he's probably a cutie. There we are, sleep and osteoporosis. You cannot build bone if you're sleep deprived. You cannot build tissue repair if you're sleep deprived. You can't control your immune system if you're sleep deprived. And oversleeping more than 9 hours is just as bad as undersleeping. And trying to have a consistent sleep schedule with your circadian rhythm is the ideal thing. By that, we try to wake up at the same time every day without the alarm clock. If you wake up with the alarm clock, you've broken your rhythm of sleep. and you're starting off the day in stress. That's a high alert for your heart when the alarm goes off. So you jump out of bed and you're in stress right away. So that's not a good thing. So you back up your bedtime by 15 minutes. They don't suggest anything more than that. And try to get your full sleep rounded out so that you wake up without the alarm and feel rested. That is it's a project. It takes a while, but it's all for your health. And sleeping during the day apparently is not the best thing. If you're not sleeping at night, unless you have a night job, those are tough.
Mm-hmm.
That's another situation. So these are some tips. Terry, do you want to read those?
Okay. Sleep in a cool and dark room. Put screens away at least 2 hours before bedtime.
Think about that, 2 hours.
Yeah.
Does that mean television?
Yeah.
Or iPhones or iPads?
Right. Yeah. Find your natural circadian rhythm so you can wake without an alarm clock. Have a consistent routine before bed.
Like, well,
brush your teeth.
yeah,
Read a little from a relaxing book.
whatever.
Yeah.
Set your table for breakfast. Some people have a lot of routines that they do before they go to bed, but we learn to do that with children. They put their pajamas on, they brush their teeth, they have a story read to them, they're given an animal, either a real cat or a stuffed animal, and on it goes. And some children will have a laundry list of rituals. They won't let you out of the bedroom sometimes. But you have to make your own, whether it's putting on face cream or taking off makeup or brushing your teeth, like Terry says, or having some meditation or some reading or some breathing exercises, head tapping. They say once you have a consistent routine, you will sleep better.
Train yourself into relaxation routine. That was part of it.
Mm-hmm.
We just talked about.
Yeah. So the answer is yes. Osteoporosis can be reversed with the right exercise, the right amount of exercise, the exercise that is progressive and targeted, and the right steady amounts of nutrition that bones need, and managing stress so it doesn't wipe out the exercise and nutritional benefits. Now, there's the group around one of our calcium cafes. That's what we call them. Calcium cafes. Everything we have on the table is bone healthy and has a recipe to go with them. But Osteo Fitness, as I said, was the name of my program. I'm just going to go over what's in it. It's not just an exercise program. They're a dime a dozen. And fall prevention and posture and balance, essential. Strength and resistance training targeted at your osteoporotic sites in your skeleton, which are hip, neck of the femur, spine, total spine, and hip. And wrist is awesome. It's also an osteoporotic site, but it's not always scanned. Nutrition for osteoporosis, heavy duty in my classes. Stress management, every class. Online coaching when you want it. When you need it, I will help you with the question online. When you sign up for the class, you also have access to 2 floating videos. One is on exercise and one is on self-care, ways to relax and reduce your stress. A bi-monthly newsletter that comes out with just some facts about health that would interest you regarding bone health. And we usually feature one of our members that has some interesting things to say. When you sign up for the program, as I said earlier, you have 20 minutes free, bringing in your T-scores. We go over them if you don't understand them, or if you have a medical condition and you want to know how to integrate it into the program. That's what I do. you do, as I said, receive calcium cafe recipes. And then we do have more recipes sent out. They're called Bites with Bev, and two are vegetarian and two are carne. And then if something comes along that's absolutely urgent, like if they ever said that, what would be a startling thing that we send out as a bonus?
Mm.
I can remember one thing. When they decided to pull spinach out of the calcium list and put it in the magnesium list, that was breaking news. Because for years, in some of old literature, spinach lives in the department of calcium, and it isn't. They've taken it out and switched it. They sold it to another team. So now spinach is in the magnesium team. That was a bonus. So this is going to go home with you. This is a positive result of T-scores. Now, there, walking is not enough. Osteofitness is taught in Concord, where I am right now, 336 Baker Avenue, Tuesdays and Thursdays at 11 a.m., Tuesdays and Thursdays at 4 p.m. And we have models at every single class, and Terry's our Tuesday morning model, right, Terry?
Right.
No, Thursday morning.
Thursday.
Thursday morning model. And some people like our live class in Concord. It's at 12:30 to 1:30, Tuesdays and Thursdays. And if somebody signs up for the live class, you can't make it, you have access to the Zoom or the video that you could do on the weekend. Osteofitness, I also teach it in Lexington, and we do Mondays and Fridays at 10 a.m. There's a model named Carrie who is teaching not only the hybrid class, meaning people on Zoom and people in the studio, and I'm there working with the people on the screen, coaching them, and I coach people in the room. So my job is to make sure everybody's form is dot on and nobody's making any kind of an error that could be wasted energy and not build bone, or they could injure themselves. So everybody's monitored very closely with these programs. There's no way that you could ever hurt yourself. The only way you'd hurt yourself is to stay away. Because when you come to class, people feel much better. So for registering for the Concord class, it's right there, Gabrielle Plaint. And then Lexington, you'd have to go to Christine Dean, the director of the Lexington Community Center. And there, thank you, Terry. So I think you can see my email. Most of you know it already because you contacted me to get the Zoom. So I think we're done. I hope you've had some questions. I hope you've gained some information. Is there any question I can answer now? Anybody have an answer?
Hey, Beverly.
Yes,
How are you?
I'm very fine, thank you. This is my favorite thing to talk about osteoporosis. With whom am I speaking?
It's Corey. It's Joan Curtis's daughter.
Of course. Hi, Corey. Did
Hi.
you have a question?
I do have a question. Can you talk a little bit maybe about what a pars defect is, and does it have anything to do with this in the spine?
I will not discuss it right now because we're basically dealing with general questions, and this is not a common question. All right.
Okay, got it.
Why don't you email me your question and I can do it on a one-on-one?
Sure, thank you.
You're welcome. Does anybody else have a question or a comment?
Hi, this is Maggie.
Hi, Maggie.
I'm online. Of course. Anyway, I'm not seeing anything about the financial, the payments or any of that. Is that something that if you the classes start on March 11th, is my understanding.
Yes.
Okay, I missed the how long it runs and all of that stuff. Is there somewhere I
I'm
can
gonna
find
let
that?
I want Gabrielle to address this, please.
Okay, I can email her because we've been
All
in.
right, email you. We'll
Okay,
email you.
okay,
Okay?
to where I can find that. Okay, thank you very much.
Thank you for attending.
Oh yeah, awesome,
Thank
awesome,
you.
really, really awesome. Thank you so much.
And Terry did a great job. Kathleen, are you there?
Totally. Thanks, Terry.
I am here, listening. Yeah.
Did you have a question?
Nope, I don't.
Thanks for attending.
Thank you.
Bye-bye. We're gonna sign off, Terry, okay?
Okay,
Bye-bye.
bye, everybody.